Welcome to In the Know Medical Imaging, where we make medical imaging easy to understand. Pregnancy is filled with excitement, anticipation, and countless decisions made to protect both mother and baby. But what happens when something unexpected occurs? Severe pain, an injury, a sudden illness, and your doctor recommends medical imaging. Many parents immediately ask the same question: will this hurt my baby? Today we're exploring how healthcare teams carefully choose imaging during pregnancy, why some examinations are preferred over others, and why, in certain situations, imaging may be one of the safest decisions that can be made. Most pregnancies progress without complications, but pregnancy doesn't prevent everyday medical emergencies. A pregnant patient can still develop appendicitis, kidney stones, pneumonia, or a blood clot in the lungs. They can be involved in a motor vehicle collision, experience a serious fall, or develop severe headaches that require urgent investigation. In these situations, finding the cause quickly is often essential. One of the biggest misconceptions is that all medical imaging should be avoided during pregnancy. In reality, delaying or avoiding necessary imaging can sometimes create greater risks than the imaging examination itself. The goal is always the same: obtain the information needed to provide the safest care for both mother and baby. When appropriate, ultrasound is often the first imaging examination performed during pregnancy. Ultrasound creates images using high-frequency sound waves rather than ionizing radiation. It's commonly used to monitor fetal development, evaluate the uterus and ovaries, and investigate many causes of abdominal or pelvic pain. It can also help assess organs such as the gallbladder or kidneys, depending on a patient's symptoms. However, ultrasound isn't the right test for every medical question. Sometimes structures can't be seen clearly because of their location, body habitus, bowel gas, or the nature of the condition being investigated. When that happens, another imaging examination may provide the answers needed. One examination that often surprises people is MRI. MRI does not use ionizing radiation. Instead, it uses a powerful magnetic field and radio frequency energy to create detailed images of the body's soft tissues. Depending on the clinical situation, MRI may be recommended when ultrasound cannot fully answer the medical question. It can help evaluate conditions affecting the brain, spine, abdomen, pelvis, or placenta, among many other clinical indications. Your healthcare team carefully considers whether MRI is appropriate based on your individual circumstances. If MRI is recommended, your providers will explain why it's the best examination for the clinical question they're trying to answer. The word radiation understandably causes concern for many expectant parents. But not all X-ray examinations involve the same level of exposure, and the area of the body being imaged matters. For example, a chest X-ray directs the imaging beam at the chest, not the uterus, and the amount of radiation involved is generally very low. Modern imaging equipment, carefully selected techniques, and established dose optimization practices are all designed to obtain the information needed while keeping radiation exposure as low as reasonably achievable. Every situation is different, and your healthcare team weighs the potential benefits and risks before recommending any examination that uses ionizing radiation. CT scans do use ionizing radiation, but there are situations where CT provides the fastest and most accurate answers. In an emergency, those answers can save lives. If doctors suspect internal bleeding after a serious injury, a pulmonary embolism, or another potentially life-threatening condition, waiting for a different examination may not be the safest option. Protecting the mother's health is often the best way to protect the baby. Imaging decisions during pregnancy are always individualized. Your healthcare team carefully considers the urgency of the situation, the information needed, and the most appropriate examination to answer the clinical question. Nuclear medicine examinations use small amounts of radiopharmaceuticals to evaluate how organs and tissues function. During pregnancy, these examinations are often postponed if they are not urgently needed. However, there are situations where a nuclear medicine examination may still be considered appropriate. As with every imaging decision, the healthcare team carefully evaluates the expected benefits, potential risks, and available alternatives before making a recommendation. Imaging during pregnancy is never a decision made by one person alone. Depending on the situation, emergency physicians, obstetricians, radiologists, medical radiation technologists, sonographers, MRI technologists, and many other healthcare professionals may work together to determine the most appropriate examination. Their shared goal is simple: provide the information needed to deliver the safest possible care for both mother and baby. If you're pregnant and your healthcare provider recommends medical imaging, it's completely normal to have questions. Don't hesitate to ask why the examination is being recommended, what information it can provide, and whether there are alternative options. Remember, medical imaging during pregnancy is never ordered lightly. Every recommendation is made with careful consideration of the clinical situation, always aiming to provide the best possible care for both parent and baby. Thanks for watching In the Know Medical Imaging, where we make medical imaging easy to understand. If you enjoyed this video, please like, subscribe, and share it with someone who would find it helpful. We'll see you in the next one.